distinguished partners, future healthcare experts, alumni of the Merck Foundation, distinguished media partners, and winners of the Merck Foundation Awards. They're all waiting here for you. Thank you very much to each of you for being with us today. I'm very happy to be here again, a country very close to my heart, after meeting you all last in 2022. I'm personally excited to be here today with you to follow up our long-term partnership with the Kenyan medical societies and academia and underscore our continuous support to contribute to transforming patient care landscape in Kenya. I'm proud to share with you that the Merck Foundation has provided for Kenyan doctors 165 scholarships of 1-year PG diploma and 2-year master degree in many underserved and critical medical specialties in Kenya. Specialties such as diabetes, preventive cardiovascular, endocrinology, sexual and reproductive care, gastroenterology, respiratory, acute medicine, clinical psychiatry, internal medicine, dermatology, neonatal medicine, urology, pain management, cardiology, critical care, rheumatology, fertility, embryology, oncology, and more. Virtually in every walk of medical life, we tried to qualify. The objective of this program is to contribute to building healthcare capacity with the aim to establish a strong platform of skilled and specialized healthcare providers across Kenya's public healthcare sector. In fact, our aim is to improve the overall health and well-being of people by building healthcare capacity across Africa, Asia, and other developing countries. So we are strongly committed and on our way to transforming patient care landscape through our scholarship programs. We strongly believe that empowering people will lead to a better future. We also believe good healthcare can transform the lives of individuals and families across all countries. It can significantly contribute to economic progress because healthcare is a major driver of economic growth and consequently of social progress. We should never forget that. We all know that the lack of financial means is not the only challenge in Africa, but a scarcity of trained healthcare personnel capable to tackle disease prevention, diagnosis, and management at all levels in the healthcare systems is the biggest challenge. The sweeping shortage of medical and healthcare manpower is a crucial limiting factor. As per the WHO 2017 report, just 168 medical schools are in the entire African continent. In some countries, just one medical school. In 24 countries, only one. And no medical school in 11 countries. Not to mention the Sub-Sahara Africa has 24% of the world's disease burden. Africa has only 2.8 healthcare workers per 10,000 capita. Furthermore, this is compounded by the maldistribution of workforce among urban and rural areas, and the public and the private sector. So it's all not too good and we have to work to improve it. For example, before the start of the Merck Foundation programs in 2012, there was not a single oncologist, fertility or reproductive care specialist, no diabetologist, respiratory or other specialists in countries like the Gambia, Liberia, Sierra Leone, Central African Republic, Guinea, Burundi, Niger, Chad, Ethiopia, Namibia, and so on. Therefore, together with our local partners, Merck Foundation continues their efforts in transforming patient care landscape through our Merck Foundation scholarship programs. Till today, more than 1,740 scholarships have been provided for young doctors from 52 countries in 42 critical and underserved medical specialties. That's quite a good record for the past 12 years. many of them becoming the first specialists in their respective countries, like, for example, in Namibia, Liberia, Gambia, Burundi, Malawi, Sierra Leone, Zambia, Zimbabwe, and so on. Dear partners and alumni, last but not least, I and my colleagues are glad to meet you today here and to hear from you all your feedback, which is very important to us and to all of you, your success stories and experience gained from these training and educational programs. I congratulate you all already. I know many of you have already graduated and the rest are undergoing their scholarships successfully. And it's normally all done beside your normal working day. We appreciate that you are taking your studies seriously, as it will significantly contribute towards your future personal career and towards the quality of your practice. By this, you will further contribute to improving patient access to equitable and quality healthcare in Kenya in general. Today, we are also meeting and recognizing the winners of Merck Foundation Media Awards 2023. Also present here are our award winners from past editions since 2018. Of course, Corona made a problem in that respect, so we have to catch up today. Happy to meet you all. I'm very proud of all of you. We at Merck Foundation strongly believe in the critical role that media and art plays in creating a cultural shift and to address all social and health issues in our communities. I'm sure that all of you, as our social and health care champions, know that you can and will make a change, be the voice of the voiceless, and educate the communities about various social and healthcare issues in Africa, such as supporting girl education, very important, breaking the infertility stigma, ending child marriage, stopping GBV, and ending FGM, and also focus on health issues such as diabetes and hypertension prevention, and promote healthy lifestyles. That you can do every day by giving an example yourself. Dear Merck Foundation alumni, I would also like to acknowledge your role as health champions in your own communities and to acknowledge your collaboration with our media recognition winners. These media recognition winners are also Merck Foundation alumni like yourself. To help them to sensitize community members and separate myths from fact, hence raise awareness about different critical and sensitive social and health issues in a specific and scientific and ethical way. Let's all work together to further transform the patient care landscape in Kenya and of course across the African continent. So I'm looking forward to meeting you again after the rest of you graduated to celebrate their success stories and to listen to what you have experienced over the past years during your further education programs. Thank you very much for listening.